So we scanned him and he literally had minus 2.6. He had osteoporosis of the hip, 51 years old. He came to one of our locations in Marylebone until, and he looked fit. He genuinely looked like he looked after himself. He wasn't one of these doctors that's just 10 hours a day working and not, looking after himself. And I said, well, do you mind if we scan you? And he said, well, I don't see why you would. And I said, well, let's scan you. I said, maybe we should scan you. Have you had a DEXA scan before? And his response was, no. Why would I? I said, well, that's a great question. Why would you? Well, let's see why you would. And not that I was hoping he may have osteopenia. There's a part of me thinking, well, let's just, So we scanned him and he literally had minus 2.6. He had osteoporosis of the hip. Okay, his spine was minus 1.8. Osteopenia. Now, I said to him, I want to be able to scan the conveyor belt of people that are coming along from age 30. Your question was, why would we scan? Now, you're age 51. If I could give you the last 21 years of data from age 30, would that be useful? And he said, well, of course it would. I said, okay, why would it be useful? And I had to be careful where I went here. And he just said, well, because I'd be able to intervene. And if I knew I had osteopenia at age 37, I'd do something about it. I said, and that's simply our mission. We need to proactively know the information because what we don't know, we can't manage.